Hypertension Day, I want to share some of my views. Hypertension is also called the high blood pressure, where the blood pressure is 140/90 or more than 140/90. So incidence of hypertension in India, it is more than 25 crores people. They are suffering from the hypertension. There are so many risk factors are there for the hypertension. Among that, old age, genetic predisposition, sedentary lifestyle, then unhealthy food habits, obesity, then along with that consumption of alcohol, tobacco, as well as smoking. So these are the common risk factors for the hypertension. Then broadly speaking, the hypertension, it will not give rise to any of the symptoms. But most of the people, they'll be asymptomatic. So that's why the hypertension is called silent killer. So how you come to know you are having the hypertension? Mainly when you consult your doctors, the doctors may record the blood pressure more than 2 to 3 times. Then he will diagnose you are having the high BP. Or second thing is, if you have kept the BP machine in your home, you can also record the blood pressure regularly in your home. Whenever you find the blood pressure is more than 140/90, you can consult your doctors for the confirmation of your blood pressure plus evaluation of the blood pressure. Because hypertension, there are so many causes are there. Doctors will find what is the factor is causing for the hypertension in your case. Then coming to some of the complications related to the hypertension. If your blood pressure is not controlled, if it is uncontrolled high BP blood pressure is there, sometimes you tend to suffer from the cardiovascular diseases, renal diseases, as well as the cerebrovascular accident, that is called stroke. So that's why the monitoring of the blood pressure at the optimal level is very, very important. Then how to monitor the blood pressure? For that, you have to do some of the regular exercises and controlling your weight and stoppage of all your addictions. Suppose if you are having the smoking, then alcohol consumption, tobacco consumption, you have to stop that one. That's also very important. Then avoiding the unhealthy food habits, mainly the increased salt intake, then processed as well as the junk food you have to avoid. That will also help you to control your blood pressure at the optimal level. So then coming to the exercise. So 30 minutes in a day, total 150 minutes, means 5 days in a week. You have to do some of the aerobic exercises in the form of regular walking or swimming or some gym activities or bicycle riding. All these aerobic exercises, they will also help you to control your weight as well as control your blood pressure. So diet, exercise is very, very important, and along with the healthy food habits. Then coming to after doing all these measures, if your blood pressure is not controlling, then that time your doctor will advise some medications. So the medications, doctors will advise proper drugs and proper dosages. Whatever the doctors will advise, you have to follow. And along with your medications, you have to consult your doctors once in a month, at least for the regular checkup. And if provided, you can also measure your blood pressure once in a week or once in a month. When the blood pressure is not controlling, then again you have to consult your doctor. The doctor may modify some of the medications. So that is also very, very important. So the prevention is very important than the cure. So in all the diseases, prevention is important. Coming to some of the key points we have to remember is hypertension. It is a silent killer and it is a preventable as well as the treatable disease. And third one is if you neglect the hypertension, so definitely you are going to suffer some of the mortalities and morbidities. So that's why the healthy food habits are very important. Along with the medications, you can lead the healthy, happy, and long life.